Everybody's heard this from an owner. Well, it still eats, so it cannot be painful. This is the biggest misconception out there. I've had dogs with jaw fractures and big abscesses and everything, and they still eat perfectly fine. You know why they eat? Because they're hungry. They need to survive. They don't have this instinct of if they stop eating, what will happen? They will starve. And so they won't let you do that. So the way I approach this is when I started as a vet, when a dental patient was admitted, it was admitted through the reception. So the owner would come in the morning with the dog and say, here's my dog for the cleaning. Call me when it's done. Okay, bye-bye, see you. So what happens is they delivered a perfectly healthy looking dog for a cleaning. So you get this dog on the table, and the typical thing happens is that you find multiple teeth that need extraction. And now you have to call this owner, and you've never met this person before. So some stranger from the clinic suddenly calls this owner and say, hey, this is Dr. Morten. I found 15 teeth we need to extract. It's going to cost you 2,000 euro. Do you want it or not? When you do this to an owner, they will feel pressured for good reason, right? And it's not a good experience for everybody. What they thought would be a routine cleaning suddenly was a multiple $1,000 procedure on a dog they thought was healthy. So there's a much, much better way to do it. And that is by setting aside 15 to 20 minutes every morning where you personally, you or your lead technician who's doing dentistry with you, are taking this patient in and talking to the client.